Gerhard, hello.
Hi, Kerry. I've got a few points I want to raise. My name is Gerhard Sundborn, and I'm an epidemiologist with the University of Auckland, and also I'm part of the COVID Plan B group. And I've been listening to your discussions for the past few days in particular, but also over the last few weeks.
Yeah.
And I've just got a few points I'd like to kind of raise that I think are totally relevant. And the first one is about how deadly the virus is. And so the CDC in the US has said that the virus is between 0.02 and 0.86, has a case fatality rate of that, which is actually comparable to influenza, which is 0.1 and 0.5. So it's not that deadly. However, where the concern lies is that in those over 70 or over 65, that's really where it becomes more concerning for elderly people. So, the point about locking down the whole of Auckland or the whole of the country, whether that's a good idea or whether it's better to wrap care around our elderly, care facilities and hospitals, we think that is one of the key things that we've advocated for a while. The second thing is around lockdowns. And so, recently the WHO have come out and said that we need to learn to live with this virus. And also, too, they've come out with the experts saying that lockdowns don't work. And so we've seen evidence in the US. There's a number of states that have lockdown and other states have not. And there's been no real difference in the number of fatalities. And the key component is actually population density and the demographics and the age of the people within those communities and states. And, people raise, what about Sweden? They didn't lock down, and look at them. But actually, if you look at Sweden compared to other places that did lock down, like the UK, they fare better than some of the places that have locked down. So that adds to the point that it's not the locking down, it's around population density and things like that. And so then that leads us on to the point about elimination. Now, there's been interesting new definitions of what elimination means in terms of epidemiology over the course of this pandemic. The WHO, they have a set of criteria that determines whether a country has eliminated a disease or a virus or not. And in particular, one for measles, the criteria is that you need to have it eliminated for 36 months. So, although we went for 100 days, which is about 3 months, we still have about 33 months to go before we would have come close to elimination, and that's with the good surveillance, meaning good testing, things like that. Now, we were, a while ago, there was a report saying we wanted 5,500 tests per day, and one particular day we had 8. So it shows our testing and our surveillance isn't too good. And then once we've achieved 36 months of no cases, there needs to be genotyping evidence so that any new case comes, we can compare their genotyping to the virus we've got to make sure it is different and it's not the same. So we're far, far away from the possibility of elimination. We haven't achieved it. It takes 36 months before we can actually be considered about achieving it under WHO criteria. The last point I want to make is around a vaccine. So we have there's good evidence that for a vaccine to be developed, in the best case scenario, the fastest time it's taken for a vaccine to be developed is 4 years, with the average up to 10 years. Now, and there's many cases where viruses, we have never been able to develop a vaccine for instance, HIV. So, if we're going to lock down and keep our borders closed in the hope and in the wait for a vaccine for, in the best case, 4 years, in the worst case, never, I just can't see the logic in that. And so I think, we initially, and our Prime Minister initially said we've got to flatten the curve and we don't want our hospital system to get overwhelmed. I think we need to go back to that. We need to protect our elderly care facilities and our hospitals, and we've got to get away from this fantasy of elimination because it's driving everything. And also, I think we need to clearly accept how dangerous this virus is, and it's not as dangerous as the fear that's been instilled into our community.
Absolutely. Gerhard Sundborn, epidemiologist at Auckland University, not just somebody with a few reckons.